MCC950 sodium is a small molecule inhibitor that specifically targets the NLRP3 inflammasome, a protein complex involved in the activation of the inflammatory response. The NLRP3 inflammasome is a key component of the innate immune system and is responsible for the production of pro-inflammatory cytokines, such as interleukin-1b, IL-1b, and interleukin-18, IL-18. Inflammatory responses are essential for the body's defense against pathogens and tissue damage. However, excessive or prolonged inflammation can lead to various chronic inflammatory diseases, including autoimmune disorders, neurodegenerative diseases, and cardiovascular diseases. MCC950 sodium works by binding to the NLRP3 protein and inhibiting its activation, thereby preventing the release of IL-1b and IL-18. This inhibition of the NLRP3 inflammasome helps to reduce the inflammatory response and alleviate the symptoms associated with inflammatory diseases. The effectiveness of MCC950 sodium has been demonstrated in various preclinical studies and animal models of inflammatory diseases, including gout, rheumatoid arthritis, multiple sclerosis, and Alzheimer's disease. These studies have shown that MCC950 sodium can effectively suppress the production of IL-1b and IL-18, leading to reduced inflammation and improved disease outcomes. Furthermore, MCC950 sodium has also shown potential in the treatment of other conditions, such as atherosclerosis, type 2 diabetes, and non-alcoholic fatty liver disease, which have an underlying inflammatory component. MCC950 sodium is typically administered orally or intraperitoneally in animal studies. Its pharmacokinetic properties, including absorption, distribution, metabolism, and elimination, have been investigated, and it has been found to have good bioavailability and a relatively long half-life, allowing for sustained inhibition of the NLRP3 inflammasome. Overall, MCC950 sodium represents a promising therapeutic option for the treatment of various inflammatory diseases by specifically targeting the NLRP3 inflammasome and modulating the inflammatory response. Further clinical studies are needed to evaluate its safety and efficacy in humans, but it holds great potential for the development of novel anti-inflammatory therapies.